Listen, I don't care if you think Medicare is going to take care of everything. I care about whether you're going to lose your entire retirement savings to medical expenses that Medicare doesn't cover. And right now, if you're heading into retirement thinking Medicare is comprehensive health insurance, you're about to get financially destroyed. I'm Charles Wellington, and I've been a retirement planning specialist for 38 years. I've watched countless retirees discover too late that Medicare has massive gaps in coverage. I've seen people lose their homes to pay for long term care. I've seen retirement accounts drained by out of pocket medical expenses. And I've seen families devastated financially because they didn't understand what Medicare actually covers. What I'm about to reveal is going to shock you because I'm going to expose 5 massive healthcare expenses that Medicare does not cover. Expenses that are costing retirees tens of thousands, even hundreds of thousands of dollars. Expenses that are completely predictable, but somehow nobody prepares for. Before I reveal these 5 retirement destroying expenses, I need you to do something. If you're within 10 years of Medicare age, if you're already on Medicare, or if you care about protecting your retirement savings from medical bankruptcy, hit that subscribe button right now. Smash it. This channel is dedicated to revealing the financial truths that nobody else will tell you. We deal in reality, not the fantasy that the healthcare system wants you to believe. So subscribe, join this community, because what I'm about to tell you could save you hundreds of thousands of dollars in unexpected medical costs. Let's get brutally honest about something. Medicare is not free healthcare. It's not comprehensive coverage, and it has enormous gaps that will financially devastate you if you're not prepared. Here's what most people think. They think they work for 40 years, they pay Medicare taxes, they turn 65, and suddenly all their healthcare is covered. They think Medicare is like the health insurance they had through their employer. They're wrong, catastrophically wrong. Medicare Part A covers hospital stays. Medicare Part B covers doctor visits and outpatient services. But that's it. There are massive gaping holes in Medicare coverage. And those holes are where your retirement savings are going to disappear. The average couple retiring today at age 65 will spend approximately $315,000 on healthcare costs throughout retirement. That's not a typo, $315,000. And that's just the average. If you have chronic conditions, if you need long-term care, if you develop serious health issues, you could spend double or triple that amount. I'm going to walk you through 5 specific healthcare expenses that Medicare does not cover. I'm going to show you exactly how much they cost. I'm going to give you real examples of people who've been financially destroyed by these expenses. And I'm going to tell you what you need to do to protect yourself. Here's what you need to understand. The healthcare industry doesn't want you to know about these gaps until it's too late. They want you to think you're covered, they want you to relax, and then when you need care, they hit you with bills that can consume your entire life savings. You know what keeps me up at night? Sitting across from a 75-year-old couple who just received a $180,000 bill for nursing home care and watching them realize that Medicare isn't paying any of it. Watching their faces when they understand they're going to have to sell their home, liquidate their investments, and spend down everything they saved just to pay for care that they assumed Medicare would cover. That's not going to be you, because I'm going to give you the information you need to prepare for these costs. But before I reveal expense number 1, you need to understand something. This is not about politics. This is not about whether Medicare should cover these things. This is about the reality of what Medicare does and doesn't cover right now. And if you don't plan for it, you're going to pay the price. Are you ready? Are you ready to see the 5 healthcare expenses that are going to drain your retirement savings? Good. Let's start. This is the single biggest financial threat to your retirement, and Medicare covers almost none of it. Let me be crystal clear about this. Medicare does not pay for long-term care, not in a nursing home, not in an assisted living facility, not for in-home care. Here's what people think. They think, I paid Medicare taxes my whole life. If I need to go to a nursing home, Medicare will pay for it. Wrong. Medicare will only pay for skilled nursing facility care for a maximum of 100 days and only if you're recovering from a hospital stay. And even then, after the first 20 days, you're paying a copay that's currently about $200 per day. But what about when you need custodial care? When you can't dress yourself, can't bathe yourself, can't feed yourself, when you need someone to help you with daily activities? That's not skilled nursing, that's custodial care. And Medicare doesn't pay a dime for it. Let me show you the numbers. The average cost of a private room in a nursing home is now over $108,000 per year. The average length of stay is 2.5 years. That's $270,000. And Medicare pays zero. For assisted living facilities, the average cost is about $54,000 per year. For in-home care, you're looking at $30 to $35 per hour. If you need 8 hours per day of in-home care, that's $84,000 to $102,000 per year. Let me give you a real example. I worked with a couple, Robert and Helen. Helen developed Alzheimer's at age 72. She needed full-time care. Robert couldn't provide it alone. They placed her in a memory care facility, cost $96,000 per year. Robert thought Medicare would cover it. It didn't. Over the next 6 years before Helen passed away, they spent $576,000 on her care. Their entire retirement savings gone. Robert is now 80, living on Social Security alone in a studio apartment. Everything they worked for wiped out by one illness. This is not rare, this is common. About 70% of people over age 65 will need some form of long-term care during their lifetime. And the average cost will devastate most families' finances. So what do? You plan for it. There are three strategies. First, long-term care insurance. If you're in your 50s or early 60s, you can still get coverage at reasonable premiums. A policy that pays $150,000 to $200,000 in benefits might cost $3,000 to $5,000 per year. That's expensive, but it's nothing compared to the cost of care. Second, hybrid life insurance with long-term care riders. These policies combine life insurance with long-term care benefits. If you don't use the long-term care benefit, your heirs get a death benefit. These are more expensive but provide more flexibility. Third, self-insure by setting aside significant assets specifically for potential long-term care costs. But this means having $300,000 to $500,000 in liquid assets that you're willing to earmark for care. Most people can't do this. Here's the rule. If you don't have a long-term care plan and you don't have at least $500,000 in liquid assets, you're at serious risk of financial devastation. Don't assume Medicare will cover it. It won't. Here's something that shocks people. Medicare does not cover routine dental care. No cleanings, no fillings, no crowns, no dentures, no root canals, nothing. And dental problems don't stop when you turn 65. In fact, they often get worse as you age. Receding gums, tooth decay, gum disease, tooth loss, all common in seniors and all expensive to treat. The average senior spends about $100 or $200 per year on dental care out of pocket. Over a 25-year retirement, that's $30,000. But that's just routine care. If you need major work, implants, dentures, extensive periodontal treatment, you could be looking at $20,000 to $50,000 or more. Let me give you a real example. I had a client, Frank, who was 68. He had neglected his dental health for years. He needed extensive work, extractions, bone grafts, and dental implants. Total cost, $43,000. Medicare paid zero. His dental insurance through an AARP plan covered $1,500 per year maximum. Frank paid $4,500 out of pocket. That was money he had earmarked for travel and retirement. Instead, it went to his teeth. His retirement lifestyle was permanently downgraded because he didn't budget for dental care. But here's what makes this worse. Dental health is connected to overall health. Gum disease is linked to heart disease, diabetes, and stroke. If you neglect your dental health because you can't afford it, you can develop more serious health problems that cost even more. So what's the solution? First, get dental insurance. Medicare Advantage plans sometimes include limited dental coverage. Standalone dental insurance is also available, though it typically has low annual maximums of $1,500 to $2,500. Second, budget for dental care. Assume you'll spend $1,000 to $2,000 per year on routine care and set aside an emergency fund for major work. If you're 60 and retiring at 65, start saving now. Third, take care of your teeth. Prevention is infinitely cheaper than treatment. Brush, floss, get regular cleanings, and address problems early before they become expensive. Here's the reality. You will have dental expenses in retirement. If you don't plan for them, they're going to come out of your retirement savings or you're going to neglect your health. Neither is acceptable. Medicare Part D covers prescription drugs, but it has a coverage gap that's appropriately called the donut hole. And if you fall into the donut hole, you're going to pay enormous out of pocket costs. Here's how it works. You pay premiums for Part D coverage. You have a deductible, typically around $500 to $600. Then you pay copays on your prescriptions until your total drug costs reach about $5,030. After that, you enter the donut hole. In the donut hole, you pay 25% of the cost of covered brand name drugs and 25% of generic drugs. That doesn't sound terrible until you realize how expensive drugs are. If you're taking multiple medications, especially brand name drugs, your 25% share can be thousands of dollars per month. You stay in the donut hole until your out of pocket spending reaches about $8,000. Then you enter catastrophic coverage, where you pay just 5% of drug costs. But getting to that catastrophic coverage means you've already spent $8,000 out of pocket that year. Let me give you real numbers. I worked with a woman, Patricia, who was 71 and had rheumatoid arthritis. She was prescribed Humira, a biologic drug. The cost was about $7,000 per month. Her Part D plan covered it with a $50 copay per month during initial coverage. But after she hit the initial coverage limit in March, she entered the donut hole. Her 25% share of Humira was $1,150 per month. From April through July, she paid $7,000 out of pocket just for one medication. Then she hit catastrophic coverage and her costs dropped. But that $7,000 wiped out her emergency savings. She had to choose between her medication and other expenses. Many seniors in her situation skip doses, cut pills in half, or stop taking medications entirely because they can't afford them. Now, the Inflation Reduction Act made some improvements. There's now a $2,000 annual cap on out of pocket drug spending starting in 2025. That's better than before, but $2,000 per year is still $50,000 over a 25-year retirement. So, what do you do? First, understand your Part D plan. Know the deductible, the coverage limits, and what you'll pay in the donut hole. Second, ask your doctor about generic alternatives. Generics are dramatically cheaper. Third, use mail order pharmacies for maintenance medications. They're often cheaper than retail. Fourth, budget for it. Assume you'll spend $2,000 to $4,000 per year on prescription drugs. If you take expensive medications, it could be much more. Plan for it now. And fifth, consider Medicare Advantage plans. Some have lower prescription drug costs than traditional Medicare with Part D, but be careful. The trade-offs aren't always worth it. Medicare does not cover routine vision care, no eye exams for glasses, no contact lenses, nothing. Medicare will cover eye exams and treatment if you have a medical condition like glaucoma, cataracts, or macular degeneration. But routine vision care, you're on your own, and vision problems increase with age. Presbyopia, cataracts, macular degeneration, glaucoma all become more common as you get older, and treating these conditions is expensive. Let me show you the costs. A routine eye exam costs $50 to $250. Glasses cost $200 to $600 depending on the frames and lenses. If you need progressive lenses or special coatings, add another $100 to $300. Contact lenses can run $300 to $700 per year. Cataract surgery, which is eventually needed by about half of all people over 75, costs $3,500 to $6,000 per eye if you want premium lenses. Medicare covers basic cataract surgery, but if you want the premium lenses that correct astigmatism or allow multifocal vision, you pay the upgrade cost out of pocket. For both eyes, that's $4,000 to $8,000. I had a client, Donald, who needed cataract surgery at age 73. His ophthalmologist recommended premium toric lenses that would correct his astigmatism. Medicare covered the basic surgery, but the premium lens upgrade was $3,200 per eye. Donald paid $6,400 out of pocket. He could have chosen the basic lenses covered by Medicare, but then he'd still need glasses for distance and reading. The premium lenses gave him better vision without glasses. It was worth it to him, but it was an unplanned $6,400 expense. And then there's macular degeneration treatment. If you develop wet macular degeneration, you need injections directly into your eye every month or two. Medicare covers the procedure, but you still have Part B copays and coinsurance. The out-of-pocket costs can be $200 to $400 per injection. Over years of treatment, that's tens of thousands of dollars. So, what's the solution? First, get vision insurance. Many Medicare Advantage plans include vision coverage. Standalone vision insurance is also available, typically costing $15 to $30 per month and covering one eye exam and partial costs for glasses annually. Second, budget for vision care. Assume $500 to $1,000 per year for routine care and set aside an emergency fund for major procedures. Third, take care of your eyes. Wear sunglasses. Manage chronic conditions like diabetes that affect vision. Get regular eye exams even if you think your vision is fine. Early detection of problems is much cheaper than late stage treatment. Vision care is not optional. You need your eyes, and you need to budget for the costs that Medicare doesn't cover. Medicare does not cover hearing aids, not the devices themselves, not the fittings, not the adjustments, nothing. This shocks people because hearing loss is incredibly common in seniors. About one-third of adults over 65 have hearing loss. By age 75, it's nearly half. Hearing loss isn't just an inconvenience. It's linked to social isolation, depression, cognitive decline, and even dementia. But hearing aids are expensive. A pair of quality hearing aids costs $2,500 to $7,000. The average is about $4,600, and they need to be replaced every 5 to 7 years. Over a 25-year retirement, that's 3 or 4 sets of hearing aids. Total cost $15,000 to $25,000, and that's just the devices. You also need professional fittings, adjustments, cleanings, and repairs. Add another $500 to $1,000 per year for maintenance. Let me give you a real example. I worked with a couple, Edward and Joyce. Edward developed hearing loss at age 68. He struggled to hear conversations, stopped going to social events, and became increasingly isolated. Joyce begged him to get hearing aids. Edward finally went to an audiologist. The recommended hearing aids cost $5,400. Medicare didn't cover any of it. Edward and Joyce had to pay out of pocket. They couldn't afford $5,400 at once. So Edward went without hearing aids for 2 more years while they saved up. His isolation worsened. His relationship with Joyce suffered. His quality of life deteriorated. When he finally got the hearing aids at age 70, it was life-changing. He wished he'd done it sooner, but the $5,400 cost was a major financial burden that they hadn't planned for. And here's what makes this worse. Many people with hearing loss never get hearing aids because they can't afford them. They suffer through social isolation and cognitive decline because of a financial barrier. So, what's the solution? First, some Medicare Advantage plans now offer hearing aid benefits, typically $500 to $2,500 per year. If hearing loss runs in your family, this might be worth considering. Second, look for lower cost options. Over the counter hearing aids are now available for mild to moderate hearing loss, costing $500 to $1,500. They're not as good as professionally fitted hearing aids, but they're better than nothing. Third, some states and nonprofits offer assistance programs for low income seniors. If you qualify, you might get hearing aids at reduced cost or free. Fourth, budget for it. If you're in your 60s, assume you'll need hearing aids at some point. Start setting aside money now. $5,000 over 25 years is $200 per year. That's manageable if you plan ahead. Hearing loss is not inevitable, but it's common, and the costs are not covered by Medicare. Plan for it. So, those are the 5 massive healthcare expenses that Medicare does not cover. Long-term care that can cost $300,000 or more. Dental care averaging $30,000 to $50,000 over retirement. Prescription drugs costing $2,000 per year or much more. Vision care, including premium cataract lenses and treatments. And hearing aids costing $15,000 to $25,000 over retirement. Add it all up, a couple retiring today should budget at least $350,000 to $500,000 for healthcare costs that Medicare doesn't cover. And that's conservative. If you need significant long term care, it could be double or triple that amount. Now, here's what you need to do. First, understand what Medicare actually covers. Don't assume, don't guess, know the gaps. Second, get supplemental coverage. Medigap policies cover some Medicare cost sharing, but not the big gaps like long term care and dental. Medicare Advantage plans sometimes cover more, but they have networks and restrictions. Evaluate your options carefully. Third, consider long term care insurance if you're in your 50s or early 60s. It's expensive, but it's cheaper than paying for care out of pocket. Fourth, budget for these expenses. Don't just save for retirement, save for health care in retirement. Assume you'll spend $300,000 to $500,000 as a couple on health care not covered by Medicare. Fifth, take care of your health. Prevention is infinitely cheaper than treatment. Exercise, eat well, don't smoke. Manage chronic conditions. The healthier you are, the lower your healthcare costs. Here's what successful retirees do. They understand Medicare's limitations. They budget for healthcare costs. They get supplemental insurance. They set aside emergency funds specifically for medical expenses, and they take care of their health. Here's what unsuccessful retirees do. They assume Medicare covers everything. They don't budget for healthcare. They skip insurance because it's expensive, and then they get hit with massive unexpected bills that destroy their retirement. You know what the difference is? Planning. That's it. The healthcare costs are the same for everyone. But the people who plan for them survive financially. The people who don't end up broke. I've been doing this for 38 years. I've seen hundreds of retirees get financially destroyed by healthcare costs they didn't anticipate. And every single time it was preventable. They just didn't know what they didn't know. If this video opened your eyes, if you realize you need to prepare for healthcare costs in retirement, I need you to hit that like button right now. I need you to share this with everyone you know who's approaching Medicare age, because this information could save them from financial disaster. And subscribe to this channel. This is where we give you the retirement planning strategies that actually work. This is where we tell you the truth that nobody else will. So here's my final message. Medicare is not comprehensive health insurance. It has enormous gaps, and those gaps are going to cost you hundreds of thousands of dollars if you don't plan for them. Don't wait until you're 65 and on Medicare to figure this out. Start planning now. Budget for healthcare. Get insurance. Set aside money specifically for medical expenses, because at the end of the day, healthcare costs are the biggest threat to retirement security, not market crashes, not inflation, healthcare. And if you don't prepare for it, it's going to consume everything you've saved. I've given you the information, the gaps in Medicare coverage, the costs you'll face, the strategies to protect yourself. Now it's up to you to take action. Don't be the couple in my office at age 75 telling me they've spent their entire retirement savings on healthcare costs they didn't know were coming. Be the couple who planned ahead, who budgeted for these costs, and who's enjoying retirement without financial stress. Your future self will thank you. Thank you for watching. Now go protect your retirement from healthcare costs.